Atrial fibrillation is a common heart rhythm disorder where the upper chambers of the heart, called the atria, beat irregularly and out of sync with the lower chambers. Instead of contracting normally, the atria quiver or fibrillate, causing inefficient blood flow. This uneven rhythm disrupts the heart's ability to pump blood effectively, allowing blood to stagnate in the atria. AFib can come and go or persist for long periods. Because the condition often produces mild or no symptoms, many people live with AFib without realizing it. Despite its subtle nature, AFib poses a major health threat because it significantly increases the risk of blood clots forming inside the heart. These clots can break loose, travel to the brain, and cause a severe ischemic stroke. Understanding AFib is the first step toward recognizing how this seemingly harmless rhythm disorder can have life-threatening consequences. AFib is often called a silent killer because many individuals do not experience noticeable symptoms. Some people feel occasional fluttering or racing of the heart, while others do not feel anything unusual. Without regular checkups or heart monitoring, AFib can go undiagnosed for years. The danger lies in the stealthy formation of blood clots inside the heart. Because the atria do not contract effectively, blood pools and thickens, creating ideal conditions for clot development. Once a clot forms, it can travel to the brain within seconds and block a major artery, causing a large stroke. AFib-related strokes tend to be more severe, leading to significant disability or death. Recognizing AFib's silent nature highlights the importance of early detection and proactive health monitoring. The connection between AFib and stroke is straightforward but dangerous. In normal heart rhythm, the atria contracts strongly to push blood into the ventricles. In AFib, the atria quiver and fail to move blood efficiently. This stagnant blood forms clots, especially in a small pocket of the heart called the left atrial appendage. If a clot breaks loose, it travels through the blood stream and can become lodged in an artery inside the brain. This sudden blockage prevents oxygen-rich blood from reaching brain cells, resulting in an ischemic stroke. AFib-related strokes are typically severe because the clots formed in the heart are large and can block major arteries. Preventing clot formation is therefore crucial for individuals diagnosed with AFib. Although many people with AFib feel no symptoms, others may experience subtle warning signs. Common symptoms include heart palpitations, a fluttering or pounding sensation in the chest, dizziness, fatigue, and shortness of breath. Some individuals may feel chest discomfort or a sense of weakness, especially during physical activity. Symptoms can come and go, making AFib difficult to detect without proper testing. Older adults and individuals with high blood pressure, heart disease, or thyroid problems are more prone to developing AFib. Recognizing symptoms early and seeking evaluation ensures timely diagnosis and reduces stroke risk. Even mild symptoms should not be ignored, as early detection can be life-saving. AFib becomes more common with age, affecting millions of people worldwide, and individuals over 60 are at significantly higher risk due to natural changes in heart structure and function. Other risk factors include high blood pressure, heart failure, coronary artery disease, diabetes, obesity, heavy alcohol use, and thyroid disorders. Sleep apnea is another major contributor to AFib. Genetics also play a role, meaning people with a family history of AFib may develop the condition earlier. Lifestyle factors such as chronic stress, lack of exercise, and excessive caffeine intake further increase the likelihood of AFib. Understanding these risk factors helps individuals take steps to protect their heart rhythm and prevent stroke. Diagnosing AFib typically begins with an electrocardiogram, ECG, which records the electrical activity of the heart. If AFib is intermittent, doctors may use a Holter monitor or event recorder to track heart rhythm over 24 hours or longer. Echocardiograms provide detailed images of heart structure and can detect issues such as enlarged atria or valve disorders. Blood tests help identify underlying conditions like thyroid disease or electrolyte imbalances. In some cases, doctors may use wearable heart monitors to detect AFib episodes over weeks or months. Early diagnosis allows timely treatment and significantly reduces stroke risk. Routine heart monitoring is especially important for individuals with hypertension, diabetes, or other cardiovascular conditions. Treating AFib focuses on preventing blood clots, restoring normal heart rhythm, and controlling heart rate. Blood thinners such as warfarin or newer anticoagulants, DOACs, significantly reduce the risk of stroke by preventing clot formation. Medications like beta blockers, calcium channel blockers, and antiarrhythmic drugs help stabilize heart rhythm or slow the heart rate. In some cases, cardioversion, a controlled electric shock, is used to reset the heart to a normal rhythm. For long-term management, catheter ablation may be performed to eliminate abnormal electrical pathways causing AFib. Treatment plans are personalized based on each patient's condition and overall risk factors. Lifestyle changes play a major role in preventing AFib episodes and reducing stroke risk. Maintaining a healthy weight, exercising regularly, and eating a heart-healthy diet help support stable heart rhythm. Quitting smoking, limiting alcohol consumption, and managing stress are essential steps. Treating sleep apnea through CPAP or other therapies significantly reduces AFib triggers. Reducing caffeine intake, improving sleep quality, and practicing relaxation techniques also help keep the heart rhythm stable. These lifestyle habits complement medical treatment and provide long-term protection against both AFib and stroke. Early detection of AFib dramatically reduces stroke risk because treatment can begin before clots form. Individuals who monitor their heart rate regularly are more likely to recognize irregular patterns. Wearable devices, routine checkups, and blood pressure monitors with heart rhythm sensors help detect AFib early. Identifying the condition before symptoms progress ensures immediate preventive action through medication and lifestyle changes. The earlier AFib is diagnosed, the lower the chances of experiencing a life-threatening cardio-embolic stroke. Atrial fibrillation is a silent but powerful trigger of stroke. Its irregular heart rhythm creates dangerous conditions for blood clot formation, making AFib-related strokes more severe and disabling. Understanding how AFib works, recognizing symptoms, and getting screened early are essential for prevention. With proper medical treatment and lifestyle modifications, most AFib-related strokes can be prevented. Awareness is the first step toward protection. By taking proactive action today, individuals can safeguard both their heart and brain for the long term.